Okay, if you look at this, this is from the lab manual, and this is showing you the teeth that we'll be talking about. And the teeth are right side and left side are both the same. So everything here is repeated right and left. You see here, this one in the middle, this is called the central incisor. And it's also good and important to know which year it's going to arise, 7 to 8 years. So this is the central incisor. This is called the lateral incisor. This is called the canine or the cuspid. And then first and second premolars, first, second, third molars. The third molar is also known as the wisdom teeth, and this will appear later in life, like around 17 to 21. So you will need to know the years. So again, this is the central incisor, lateral incisor, so we have two incisors, then the canine, which is also known as the cuspid, and then two premolars, three molars. First premolar, second premolar, first molar, second molar, third molar. Same thing for the left side, and same thing down here, central incisor, lateral incisor, this is the cuspid or canine, first and second premolars, first, second, third molars. So if you apply this on this model here, these are the teeth. This is central incisor, lateral incisor, canine or cuspid. This is the first premolar, second premolar, first molar, second molar. The third molar is not showing here, or maybe they cut it a little, it's not showing here. It will develop after 17 to 21. This is obviously the gum, which is holding the soft tissue that's surrounding different teeth. Okay, if you look at this picture here, and then we will apply it on the model that we have. If you look at the teeth, any teeth in general, it consists of the upper part that actually appear. This is what you can see outside. This is called the crown. And this is where if you have like a root canal or something, and they say we'll give you a crown, they will erode this and remove part of it and put another crown from outside. But this part that appear, that you can actually see, this is called the crown. The second part, which is right here by the gum, this will be the neck, which is this part here, and the rest is called the root. So three parts of the tooth: crown, neck, root. Now the layers, if you're looking at the layers here, this part here that actually in contact with the food, this is called the cusp, which is the upper part. And then the layers, this is the enamel, and this is the hardest of all, that's surrounding and protecting your teeth. This followed by the second layer, which is the dentine. And then this cavity inside, this is called the pulp cavity. This is the gingiva, and this is called the gingival sulcus, which is a sulcus or depression between the gingiva and the crown, the beginning of the crown. This sulcus right here, gingival sulcus. And the root here, this is the cavity that we talked about, the pulp cavity inside, and it contains three things. It contains the branches of alveolar, nerve, artery, and vein. Alveolar. This is all goes in here. This part specifically of the cavity, this is called the root canal, and we all hear about the root canal. The way they do it is they open here and get inside all the way to the root canal and kill everything, the nerves that are in here, so you don't feel it anymore. This is called the root canal. So this is a canal within the root. These surrounding this layer, so the dentine is here, the enamel is the outermost, and it is the strongest of all. But if you look here, you will see cementum, which is cementing the teeth to the bone, which is the alveolar bone in this side. And there are ligaments here that's called periodontal ligaments that hold the teeth to the actual bone, go through the soft tissue down here. This is called the epical foramen. The epical foramen is where the nerve, artery, and vein enter and leave. If you apply this on this model here, so this part here will be the crown, this is the neck, and this is the root, the whole thing here. This is enamel, which is the hardest of all, and this part up here is called the cusp, which will be actual contact with the food. This green here is called the dentine, and this inside here is called the cavity. This is the gingiva, and this is the sulcus that we were talking about right here, which is the gingival sulcus, which is right here. This is the bone, depending on which one are we talking about. If this is the lower teeth, that will be the bone of the mandible. If it is the upper part, like here, so this is basically like this. This is one of those, which is the mandibular, which is the lower set of teeth. The upper part will come from the maxilla, so depending on which part, but this is a bone anyway. And this will be the dentine, this is the pulp cavity, and this is the root canal. This is the canal within the root, this is the root. So this is the root canal, this is epical foramen, and you see here red, blue, yellow, which are the alveolar artery, which is red, blue, which is vein, leaving, and the yellow will be the nerve. And I mentioned the root canal, they make an opening here and they go like this and destroy everything inside here so that you don't feel the pain. Specifically, they kill the nerve inside here. And this is called the cementum, which is this part here. That's cementing the teeth to the bone, and you see these structure going like this. This is called the periodontal ligament that's holding or attaching the teeth to the bone surrounding them. Okay.